our first finalist, she is the owner of Health House Family Clinic based out of Bayfield, Wisconsin. She's a CHEK exercise coach as well as a classically trained Oriental medicine physician and a HTMA nutritional therapist. She combines her knowledge of Oriental medicine with her CHEK training to obtain excellent results with her clients naturally where traditional medicine has failed. Let's give a warm welcome to Julie Casper.
Give me the clicker. Thank you. Well, there's so much we could talk about, but we only have a few minutes. So, hi, I'm Julie. And in addition to my CHEK training, I'm an Oriental medicine physician. And as Tristan said, I have a clinic in northern Wisconsin. I am the executive director of omclinic.org, which is an Oriental medicine advocacy and educational organization. Also, I am an HTMA nutritional therapist. If you're unfamiliar with this, HTMA nutritional balancing uses hair tissue mineral analysis to analyze body chemistry. And it's the most effective protocol I've found for addressing nutrient deficiency and toxic body burden. There are so many awesome things happening in the field of health and wellness right now. A lot to be excited about. But there's a problem I would like to discuss. It is the way some aspects of modern technological medicine contribute to the degradation of health and the environment. In 2002, Stephen Buhner authored this excellent book, The Lost Language of Plants. Here's an excerpt from chapter 5, The Environmental Impacts of Technological Medicine. The vast majority of pharmaceutical drugs do not heal diseases. They control symptoms by introducing chemical mediators at specific levels into the body. People with high blood pressure, for example, are not cured when they take medication, which is why they have to take it regularly, often for the rest of their lives. Unlike plants, blood pressure medication and nearly all pharmaceuticals are not a normal part of the diet, nor a food previously encountered in our evolution. And 50 to 95% of each drug taken is excreted chemically unchanged or unmetabolized. Many excreted pharmaceuticals and their metabolites are not biodegradable and go on producing chemical effects forever. At my clinic, we have several patients with cancer who are also receiving chemotherapy. It is really sad to watch their deterioration. I think they're simply afraid, and they just do not want to face the fact that chemotherapy does not work. In his book, The MD Emperor Has No Clothes, Dr. Peter Glidden references a study published in 1994 in the Journal of Clinical Oncology. They did a meta-analysis for 12 years on adults who developed cancer and received chemotherapy. The results? 97% of the time, chemotherapy does not work. A 97% failure rate. Chemotherapy is an utterly devastating failure. And about 1 million people per year receive chemotherapy in the United States, about 4 out of 5 cancer patients. A regimen of chemotherapy for a single patient can entail massive quantities of drugs over a substantial period of time. Chemo drugs are extremely toxic compounds and possess mutagenic, carcinogenic, teratogenic, and embryotoxic actions. That is, they cause mutations, cancer, and abnormalities in sperm, egg, and developing embryos. Oncology nursing manuals routinely warn that chemo drugs pose significant risks to healthcare workers, such as skin damage, liver damage, chromosomal lesions, reproductive abnormalities, and blood problems. Nurses are instructed to wear heavy protective gloves when administering them, since an undiluted drop on the skin can burn a hole in the flesh. Bodily excretions saturated with the drugs are a toxic waste. And people on chemotherapy excrete over 1 billion pounds per year of bodily waste, all of which goes into the sewage stream. But researchers have found that the amounts of many of the various chemotherapy drugs entering as influent from hospitals and exiting as effluent from treatment plants are virtually identical, indicating that the drugs are not removed by sewage treatment. And they are very concerned about the presence of these drugs in the ecosystem, not just for their acute toxicity, but perhaps more for their ability to affect subtle genetic changes, the cumulative impact of which over time can lead to more profound ecologic change. In his book, Buhner discusses other kinds of technological medicine, including radiation, mercury, pharmaceutical drugs, and especially antibiotics. Bio is a Greek word which means life. Antibiotics, therefore, means anti-life. And anti-life clearly describes the unspeakable environmental impacts created by antibiotics. Do you know anyone who's taken antibiotics? These types of technomedicine are creating a serious health threat for every living being on the planet. If only there was something we could do about it. There's another excellent book you may have heard of, How to Eat, Move, and Be Healthy. In his book, Paul C.H.E.K makes crystal clear that health and wellness essentially comes down to proper nutrition and correct movement. Anyone can realize optimum health. It is our genetic heritage. And it is the healthy people who will heal our planet's suffering. Thank you, Paul C.H.E.K, for the wisdom and powerful healing tools you have given to us. To illustrate the healing power of these tools, I would like to tell you a little story. Donnie is a patient at my clinic. I first met Donnie when we hired him to clear some forest for our home and garden building site. He is a professional logger, a Vietnam vet, and a highly regarded member of our community. He is also a semi-functioning quadriplegic. Somehow, he survived that horrible war and exposure to Agent Orange. He returned home and took a construction job. At age 22, he fell from a roof, injuring his spinal cord and vertebra at C6, C7. He lost the use of his legs and some of the fine motor control in his hands. So he changed his occupation to logging. Yes, he became a logger because he could use machines to do most of the work. At age 59, he came to my clinic with a rotator cuff injury and severe carpal tunnel syndrome in both wrists. Shoulder surgery and bilateral wrist surgeries were recommended by his doctors. He was very concerned about losing the use of his arms. So he decided to try acupuncture. Technomedicine had him taking multiple medications for decades, including prescription painkillers, lovastatin for high cholesterol, prescription antacids, and prescription stool softeners. Even though he was on all of these drugs, he was still constipated and had very poor digestion. This is really no surprise since pain medications cause constipation and antacids destroy digestion. Even with the pain meds, he was experiencing an elevated state of chronic pain. He suffered from frequent uncontrolled muscle spasms in his legs. And as a result of nearly 4 decades in a wheelchair, he had spinal kyphosis and functional scoliosis, and absolutely zero core function. On top of all this, he suffered with post-traumatic stress disorder from his experiences in Vietnam, causing sleep disorders and anxiety attacks. The initial focus of therapy was to heal his shoulder and wrist injuries, as well as reduce his pain to get him off of the destructive pain meds. This was accomplished in 2 months with a combination of acupuncture and herbal therapy. We then focused on digestion, moving him away from his harmful American-style diet and towards nutrient-dense, high-quality foods. HTMA nutritional balancing therapy completely eliminated the need for antacids and stool softeners, and for statin drugs. Not that he should have ever been on them in the first place, but that's a whole nother story. I brought Donnie to a beloved mentor of mine in British Columbia, Ed Fuez. Ed performed a complete musculoskeletal assessment and designed a therapeutic exercise program to regain core function and functional range of motion. Donnie then spent about 12 hours per week at our clinic, mostly in the gym. 1 year later, Donnie was off all medications. His digestion was working smoothly. He was pain-free with nearly full range of motion of all of his joints. His scoliosis was corrected, and he had full thoracic range of motion. His core was turned on, and he could sit up without support. The muscle spasms were very rare and minor when they did occur. The PTSD symptoms resolved, and he was sleeping soundly. Also, he was performing squats on a total gym and riding the cycle trainer. Can you imagine how that would feel after nearly 40 years confined to a wheelchair? This spring, at his annual VA physical, he passed all tests with flying colors. The VA discontinued all of his medications and no longer recommended surgery. While clinically rewarding and valuable, Donnie's is an extreme case. Just think of the dramatic and positive results proper nutrition and correct movement can achieve when applied to healthier, less damaged, and younger people. Our CHEK training gives us extraordinary, powerful healing tools, and each of us has special talents and abilities that no one else can express as well as you. Abilities that enable you to make positive changes in the health of people and of the earth. And our poor, distressed planet needs us right now, urgently. In his 1990 book, Empty Harvest, Dr. Bernard Jensen discusses the synergistic connection between human health and the health of our planet. He explains how and why we must work hard to restore planetary health. The work of restoration of planetary health does not pit us against each other. Rather, it binds us together, planet, human, animal, plant, microbe. If the great nations of the world truly desire health and prosperity for their citizens, this is the work that will employ all. This is the work that will heal all. But you and I cannot wait for governments to decide. We must each do our part to return nourishment to Mother Earth, even as we take nourishment from her. As we work together to help nature become cleaner and our air, water, and soil quality is restored, we will witness the birth of a new world civilization in which the integrity of nature, the integrity of life, the integrity of body, mind, and morality in humankind is full of interdependent health, prosperity, and peace. This is a good book. You have the power not only to heal people, but you will also help heal the planet. Please search deeply with your heart. Find and strengthen your unique powers and join forces with others when needed. Because together, we will change this world. Buckminster Fuller once said, "You never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete." The challenge we face together is to create a better, healthier reality. And what could be more interesting and rewarding? And really, what could be more fun? Thank you for listening. Be well.